Welcome to part 3, Senior Moment with Nurse Linda, talking about dementia. In this segment, we're going to be talking about Lewy body dementia, something you don't hear a lot about because it's a part of Parkinson's disease. That's what I read. This is Dr. Campbell behind the camera, and this is Nurse Linda in front of it. And that's because I have a face for radio. Okay.
And Lewy body dementia is a very undiagnosed form of dementia, but it's getting new recognition in the form of the TV show called Boss with Kelsey Grammer.
What?
The TV show is called Boss.
Boss?
Yes.
When's that on?
I'm not sure when it's on, to be honest with you. I don't remember what night it's on, but he plays an executive, and he has been given a diagnosis of Lewy body dementia.
Really?
And the show chronicles how he's dealing with it. Being on the medication, trying to hide the symptoms and the issues. He's at a very early stage, and how it's affecting his life, and both personally and professionally, yes.
He has Parkinson's then?
No. He was diagnosed with Lewy body dementia without the Parkinson's symptoms.
Interesting.
Yes. Because not everybody that has Parkinson's symptoms gets Lewy body dementia.
Good thing.
Mm-hmm. Yes.
Now, I have personal experience with Lewy body, and I saw it onset, rapid onset, and I saw a sweet little lady go from a sweet little old lady to a entirely different person in a matter of weeks.
Yeah.
And it's still going down. She's had it now diagnosed with for about 6 months. And she's still not the same person I knew for 40 years.
No. No.
Yeah. Sad stuff.
Yes. Lewy body takes its toll on a lot of people in a lot of different ways. But it has 3 common presentations, and this is important to recognize. Some individuals will start out with a movement disorder, leading to the diagnosis of Parkinson's disease, and later develop dementia. Another group of individuals will start out with the memory disorder that may look like Alzheimer's disease, but over time, 2 or more distinctive features become apparent, leading to the diagnosis of Lewy body dementia. And then a small group will first present with neuropsychiatric symptoms like hallucinations, behavioral problems, difficulty with complex mental activities, leading to an initial diagnosis of Lewy body dementia.
Or a combination of all of them.
Or combination. The most common symptoms include problems with memory and thinking, hallucinations, seeing things that are not there, items, people, etc., cognitive fluctuations, which is an unpredictable changes in concentration and attention. Parkinson-like symptoms, which are the rigidity, the stiffness, the shuffling gait, the tremors, severe sensitivity to neuroleptics, which is medications that are given to treat hallucinations. Along with that include antipsychotic medications, which are usually given to people with dementia symptoms, and they work very well, but not in people with Lewy body dementia. This can actually cause a life-threatening syndrome called neuroleptic malignant syndrome, which can cause kidney failure and ultimate death. So these are very important things to understand, that the diagnosis is important first. Many people will give me just medicine, let me sleep at night, let the control mom's symptoms so I can sleep. No, get your diagnosis first, so you don't start giving out medicine and find out later, oh, we shouldn't have given that because now we know what the diagnosis is. Take the time and get it looked at correctly. And it mimics so many other diseases. That's the problem with all forms of dementia. It's very difficult to diagnose.
Well, her doctor prescribed medication to calm her down. It exacerbated the situation. She went bananas, as it were. My problem was I should have had home health care people and looked after my wife for almost a year before, because she's having difficulty getting around. So I stayed home. I could be gone for an hour, hour and a half, 2 hours. But towards the end, I couldn't be gone at all because things would be turned up. She'd be under the table. She'd be on the floor. She was on the floor for 2 hours. That's how long I've gone. She fell on the floor just as I left, or right after I left. It was there, covered in breakfast food.
Mm-hmm.
So my doctor and her doctor said, call 911 if she gets agitated, and she did.
Mm-hmm.
So we called 911, and I'm 6'1", and I'm a hefty guy. It had two paramedics my size had trouble getting this 90-pound person onto a gurney. But I'm glad they did. Took her to Lexington Medical Center, did a superb job. She was there for 6 weeks before they moved her to the extended care facility in Lexington. And the people there are marvelous. They really are. But it would have been a lot easier on me and her to have a full-time caretaker come in, like your outfit, for instance, and look after her, because I had to read up on all this stuff.
Well, and many times an outside person will see changes before they actually happen. We had a situation where we were going in and taking care of Mom, and Mom and Dad lived with the son. And we then went out for a while, and then we came back to take care of Mom again, who was getting worse. And all of a sudden, we saw changes in Dad, which we didn't see before. And Dad became violent against one of our caregivers. And we said, whoa. And I told the son, I said, I really think you need to get Dad looked at. And they said, no, 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 he was just protecting Mom. We won't have anybody in the house if it upsets Dad. Now, a year later, we've been called back in. Dad had progressed and developed full-blown dementia. And now we're caring for both Mom and Dad.
Well, Lewy body, here's how it was broken to me by the medical profession. They said, Dr. Campbell, your wife has Lewy body dementia. Unfortunately, that's the worst kind of dementia you can have. And I said, well, don't sugarcoat it. Because I saw it firsthand. And
it does. It progresses very rapidly. And that's the difference in it. Even though you look back, hindsight is always the best. And you can see what was happening many years before that and the slow progression of it. But it seems like it progresses rapidly, but it really doesn't, because it had its start way back when she first started developing those Parkinson-like symptoms. Those were symptoms of Lewy body dementia.
Well, if she hadn't read Michael J. Fox's book, she would not have recognized the fact that she had Parkinson.
Exactly. Exactly. Now, the important thing to remember is that, again, getting into clinical trials, having people follow the family for genetic components, for new medications that you might not be able to get that are FDA approved that might help. At this point, are they really going to hurt? And you need to address that. The other important thing to remember is getting into support groups. And a lot of families say, well, I don't have time for support groups. But the Alzheimer's Foundation covers all forms of dementia, and they will actually pay for caregivers to come in and sit with your loved one while you attend support groups. Get out of the house, get a breath of fresh air, protect yourself as a caregiver. Absolutely. And this is Alzheimer's Month. This is Dementia Month. So this is very important to remember and look into and call and ask questions.
Well, in hindsight, looking back, I should have, well, I didn't feel like calling 911 a month and a half before, even though she was acting sometimes violent, strange. I love the woman. Been together for 40 years, 26th of September. But I should have had, if I'd had somebody from your organization or any organization in, they would have said, oh, you need to do something about this. And so, well, hindsight better than no sight at all.
Exactly.
In closing, you have 20 seconds.
Okay. Get that pre-needs assessment done, which is something that we offer at Brook Healthcare. We'll come in, there's no charge. Take a look at the big picture. Take a look at everything, the history, the progression, the medications, what your circumstances are, and make recommendations accordingly. And that is no obligation. You do not need to take our services or any other service in order to do that. We're just happy to do that.
Tune in next week. Thanks for watching Senior Moment with Nurse Linda.